you are invited to participate in a smudge before the meeting. So we will do that now, and then the meeting will start in just a few minutes.
Nice to meet you.
Kwe, okay, this is working great. Kwe, Anin, Shekhan, Tanshi, Unuksakut, and good evening, everyone. I would like to begin by taking a moment to reflect on and to acknowledge that the space we occupy today is on the unceded traditional territory of the Algonquin and Anishinaabe people who lived and continue to live on this land. It is a privilege to welcome and thank Elder Ripa and Knowledge Keeper Kristen Dumont, who are joining us this evening. Your presence brings guidance, perspective, and meaning to the work of this board and to Ottawa Public Health. I would like to extend a special welcome to Kirsten Dumont, an Anishinaabe Algonquin speaker, youth leader, and keynote speaker. Kirsten brings an important voice to this gathering, and we are grateful that she is here to offer an honoring statement, a welcome to territory, and opening reflections. Through her work, Kristen uplifts how Indigenous youth are learning from their elders and knowledge keepers, carrying forward traditions, languages, and protocols, and sharing those teachings within their communities and with others. The intergenerational exchange is vital, and it is something that public institutions, including Ottawa Public Health and this board, must continue to learn from and support. On behalf of the Board of Health, I'd like to offer you this gift of tobacco. And over to you.
Kichi Miigwech, thank you so much. Kirsten Dumont and Indigenous Kitigan Zibin and Donchnaba. Kirsten Dumont is my name. Kitigan Zibi is the community in which my family and I come from, but I was born and raised here in Ottawa on unceded, unsurrendered Algonquin and Anishinaabe territory. I want to first acknowledge how grateful I am to be here, how honored I am to be seated here, to be standing amongst you today, because this truly is history right before our eyes. It's the future changing, it's inclusion being implemented, it's voices being heard, and nations being included. I think a lot about our nations and how, as Indigenous people, health was so much more than an illness or an ailment, but it was the survival of our nations, the revitalization of our language, and the care for our children within communities. I think a lot about the communities in which I come from, the children within them, the elders I come from, the blood that runs through my veins. Because as Indigenous people, we are more than harm and hardship. Intergenerational strength. We carry intergenerational love and intergenerational kinship that I hope this country can one day be connected with. Because it is not Indigenous health versus non-Indigenous health. It is not Indigenous health versus Canadian health, but it is health for everybody, the inclusion of all, the voices from each and every one of our communities. Because when we can come together to work alongside each other, to hear each other, we create more inclusive spaces, more inclusive healthcare, and generations where we can thrive instead of simply survive on the lands of our ancestors and our nations. The work that you're doing here is important, but it's of the utmost importance today because you are not only hearing from the people within your tables, but you are hearing from generations of resilience, generations of survival. As you talk amongst yourselves, as you imagine what healthcare can be, what healthcare should be, imagine your children and the children in which your children are connected to. Because I am not just me, but I am you too. We are interconnected in so many other ways, through community, through healthcare, and through this great country that we call Canada. We do not have to be the divide that so many of us were born into. We can rebuild bridges that were once broken. We can come together to create something better. And I hope that that's truly what you do throughout your lifetime. Because every step that you take, every decision you make impacts more than just you, but it impacts generations of our nations. I want to say a big Chimigwech once again for having me here today. It's not very often that you see young Anishinaabe Kwe in front of people like all of you, but let this be the start for something new, because this is how every meeting, every board, every committee should be, included and connected. Chimigwech, thank you.
Miigwech, Kirsten, for those very powerful words and for being with us and sharing your knowledge. Kirsten led those of us who are in the room through a smudge before the meeting, and this is actually the first time, I believe, in history that we've had a smudge in this room. So I think that also signals an important shift and many good things to come. So miigwech again for being here. I'm pleased to now welcome Inuk Elder Ripa Evic Carlton, who has joined us this evening to light the kuluk and open our meeting in a meaningful and respectful way. The kuluk holds deep cultural significance as a symbol of light, warmth, and resilience within Inuit culture, and we are honored to have this tradition shared with us. In recognition of her leadership and generosity, I will be offering a gift as a gesture of our gratitude and respect. Elder Ripa, we invite you to share your reflections with us, and please accept this offer of tea on behalf of the board.
Kuya namik, tabunga kai kuya simagama, unnukati mangusukti Lucy. Thank you for having me tonight. I'll be sharing a little bit of my history, particularly the significance of the kuluk. My name is Ripa Carlton. I'm originally from a small community on the Baffin Island called Pangnirtung, Pangnirtung in Inuktitut. So when I was about 5 years old, my family was forcefully moved to that settlement back in the time. And so I'm very blessed to say that I was born on the land when my people still were solely living on the land, off the land. And the life was the same almost every day. And I have very fond memories of that lifestyle that my people led. And it wasn't that long ago we were moved. So the kuluk was the main source of light, particularly in the winter months when it's a dark season. The main source of warmth inside the kamma, which is the sod house. That would be the winter home for all Inuit that were scattered across the land in the 4 regions of Nunavut, not just Nunavut, Nunavik, Labrador, West, and the West. So that's how Inuit were, and not too long ago. So the oil, which is in the center of kuluk, was rendered from any animal fat, like seal blubber or whale blubber. And I've even heard of stories of Inuit who were inland, not near the ocean, who would render their oil from caribou fat or fish oils. So that would have been a lot harder than rendering the oil from the blubber. And the wick came from 2 plants mixed together, all from the region. One is cotton, and one we call the manik in Inuktitut, which I don't have a name in English, moss. Deborah, let me know. So a lot of hard work went into the daily living of Inuit because everything was done by hand. We had no machines, no skidoos, no Hondas. So the only way to travel would be by dog team. And I have fond memories of riding on the sled with the dogs pulling us. So Inuit never stayed in the winter camp. We always traveled depending on the season and where the animals were. So spring camping, summer camping, and then the fall camping. We always traveled. And the men would do a lot of walking when they were hunting for the caribou in the fall. And my father had taken me a few times when he went on a walk, with the husky dog. The husky dog would be to protect, I guess, the people if any wild animal came, and also the husky would also carry the meat back to the camp, to the people. So life was simple, life was nice, and how I long to be on the land some days. I do love the South now. I got used to living here. It took me about 2 years to get through my cultural shock. And I think a lot of us do feel that because we come from such small communities. So it is my honor and also my gratitude to my ancestors for them to be able to survive in a harsh, cold, dark environment in the wintertime with absolutely no outside help within the camps. The children were allowed to be children, and we created a lot of our own toys back then. And then some things were made by our mother, by the fathers for boys. And a special person in your life would also make you something. So by the time I was about 4 years old, my mother had made me a little amauti. Amauti is a baby carrier that Inuit women use when they are, well, they can use them here too in the South, but back in the time, that's how the women carried their babies. So my mother made me a miniature one, so did the other women with their daughters. We started out by carrying little puppies because we were surrounded by dogs all the time because they were the only means of traveling on the ice, the frozen ice. So it's a training time for the little girls because one day we would be carrying the real babies when our mothers were always busy within the camps. The little boys would also be trained by their fathers to become protectors one day. So that's just how Inuit. And we came for child rearing, Inunguinak, which translates into making of capable human beings. So we were taught from a very young age. And a lot of our ways were, we had to survive. Nobody would help us out. It was the people. So, so we did have celebrations, but it's different from the other First Nations group across our country. But there were good celebrations too, but a lot of it was about survival. So if it wasn't for my ancestors, Deborah and I wouldn't be here. We would not be here because they persevered, they persisted. They even had an Inuktitut name, Ayuinakta, which translates to never giving up. Let's keep moving forward. And they had to. They really had to. No medical care within these camps, no stores whatsoever. It was the people. And my great-grandmother was a very skilled midwife in her time. And so she was documented in a book called Sunrise Over Pengnurtung because a hospital was built in the 20s. In my community, a lot of people were dying. They were getting sick to illnesses that they were not immune to. So a hospital was built. It's still, the building's still up, but it's not being used like it was used back then. So very grateful for the medical intervention that happened to my people. My mother was one of the people that was sent away because she developed TB, and it was before my time. Our eldest had been born by this time, but nobody could bring anybody when they had to travel for a medical. So it's very different than it is today. Some people, a lot of people still bring escorts when they have to travel to the south for a medical time. So this could allow the people to eat, to drink water in the wintertime by melting the ice above the flames of the kuluk. So it had a real significance in our survival. And before I finish, I also wanted to share the Maligate of Inuit, the fundamental laws of Inuit that are the foundations of Inuit Kauyimayatuqangit, which are 8 principles, values that I won't get into, but the Maligate help people how to be with each other, how to treat each other well, how to have respect, all of the good things that we need as people. They also really helped us connect to our environment, because environment has always been very, very important. My early trainings were, because we always traveled, were to clean up the camp before you leave. That would be the last thing everybody would do. We were told never leave anything that wasn't there when you got there. So, and then the Maligate also can help us develop our spirituality. So these are the Maligate. Number 1, and I think everybody practices these even in here. Number 1 is working together for the common good of everyone. And then number 2, respecting all living things. We need to have that respect. Number 3, maintaining harmony and balance. That one I really try and practice, especially at the end of the day, because life is very busy down here and it's a lot faster paced than it is in our small communities. So to keep trying to have that harmony within outside, and the balance within and within outside. So number 4 is continually planning and preparing for our future. And so as an elder, I would not want to see my children, grandchildren live through what we've had to go through as people because of how things changed so drastically for us. So thank you for listening, and thank you for inviting me.
Thank you again, Elder Ripa, and again, Knowledge Keeper Kirsten Dumont, for sharing your powerful words with us and your traditions. What an incredible, powerful way to open our board meeting tonight. So again, miigwech, thank you, merci, marcy. And with that, we'll proceed to the roll call, please.
Member Bauer,
Present.
Member Bradley,
Here.
Member Carr,
Here.
Member Chung,
Present.
Member Dudas,
Present.
Member Ejiofor,
Present.
Member Gower,
Here.
Member Grutenwald, Member King,
Here.
Vice Chair DiGiovanni,
Present.
Chair Kitts.
Here.
We have quorum, Madam Chair.
Thank you very much. We have regrets this evening from Member Grunwald. Are there any declarations of interest? Seeing none, confirmation of minutes of the meeting of April 20th, 2026. Are those minutes confirmed?
Confirmed.
Thank you. There were 2 communication items that have been received and are held on file with the Board of Health Secretary. Motion to introduce reports. Member Chung, please.
Be it resolved that the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, and the reports titled Ottawa Public Health Financial Stability Verbal Report Response to City of Ottawa Motion Re-establishing a wastewater-based early warning system for toxic drug supply monitoring in Ottawa, and response to notice of motion Canada Lakes Golf Course redevelopment be received and considered. And be it further resolved that the rules of procedure be suspended in accordance with Section 33, 1B and C of the Board of Health Procedural Bylaw number 2011-1 to permit the introduction and consideration of late items, including supporting documentation for the Ottawa Public Health Financial Stability Report circulated after the agenda publication deadline.
Thank you, Member Chung. Is this carried?
Carried.
Great. Thank you, everyone. I'm going to quickly go through the agenda. 11.1 is my verbal. Will be held. A bit of an echo. Okay. 11.2, Medical Officer of Health verbal report will be held. 11.3, Ottawa Public Health's financial stability, that will also be held for a presentation. 11.4, verbal report response to City of Ottawa motion regarding establishing a wastewater-based early warning system for toxic drug supply monitoring in Ottawa. That will be held for a comment. 11.5, response to notice of motion Canada Lakes Golf Course redevelopment will also be held. So there's no items on the consent agenda. We're going to proceed right to item 11.1, which is my verbal report, and it's a little bit longer than usual, so bear with me. I did want to again thank Elder Ripa and Ms. Dumont for opening our June Board of Health meeting in such a special and meaningful way. Your words are especially timely, of course, as June is National Indigenous History Month. And with the summer solstice approaching on June 21st, National Indigenous Peoples Day, this is an important time for reflection, recognition, and renewed commitment to reconciliation. In a public health context, reconciliation means more than acknowledgement. It means actively working to address inequities, listening to Indigenous voices, and co-developing approaches that reflect the strengths, cultures, and priorities of First Nations, Inuit, and Métis communities here in Ottawa and beyond. Tout au long du mois de juin, il y a de nombreuses occasions à Ottawa pour les résidents de s'impliquer, d'apprendre et de célébrer les cultures et les contributions autochtones. I encourage members of the public and my fellow board members to participate in local events, including those taking place around National Indigenous Peoples Day, community gatherings, performances, and educational programming hosted by Indigenous organizations across the city. Vous pouvez trouver des informations sur les événements auprès des partenaires communautaires autochtones de la ville d'Ottawa et des institutions culturelles locales. Et j'encourage tout le monde à y participer de manière significative et respectueuse, pas seulement ce mois-ci, mais tout au long de l'année. I also want to briefly highlight an important issue brought forward through Ottawa Public Health regarding access to donated wild game meat for Indigenous serving organizations. As members will know, current provincial regulations prohibit the distribution of non-inspected wild game, even in cases where it has been traditionally harvested and donated within communities. Ottawa Public Health has been engaged with the Ministry of Health on this matter and is aligned with Ontario dietitians in public health in supporting changes that would expand access while advancing Indigenous food sovereignty. As a board, we recognize the importance of this issue and the broader equity considerations it raises. We will work closely with Ottawa Public Health to identify timely advocacy opportunities, whether through correspondence or other channels, to support regulatory change and help ensure policies better reflect Indigenous rights, practices, and community needs. June is also International Pride Month, and here in Ottawa, we are proud to celebrate the diversity of our 2S LGBTQ+ communities, including through Capital Pride later this summer. From a public health perspective, Pride is both a celebration and a reminder of the ongoing work needed to promote health equity, reduce stigma, and ensure that services are inclusive, accessible, and affirming for all. Ottawa Public Health continues to work alongside community partners to support the health and well-being of 2S LGBTQ+ residents, and I encourage everyone to learn more and take part in events that foster inclusion and belonging across our city. I would also like to thank members of the board for your active participation in the strategic and financial planning workshop held on May 11th. While I personally wasn't able to attend, I was briefed afterwards and heard that the discussions were thoughtful, constructive, and critically important as we look to the future of Ottawa Public Health. Members had the opportunity to hear from staff about the current strategic plan, reflect on achievements to date, and begin shaping directions for the next phase of this work. We also had important conversations about the financial pressures facing the public health sector, which are being felt across Ontario. Tes idées et tes commentaires sont essentiels pour s'assurer que notre plan stratégique reste réactif, efficace et ancré dans les besoins de notre communauté. This work matters not only to us as a governing board, but to every resident of Ottawa who relies on strong public health systems to promote well-being, prevent illness, and respond to emerging challenges. Last Tuesday, I had the pleasure of attending the Association of Local Public Health Agencies annual general meeting and conference in Toronto, along with Vice Chair Di Giovanni and Dr. Arneson. The morning featured presentations on advancing public health through Métis leadership and partnership in Ontario, as well as on projected patterns of illness across the province and its implications for Ontario's health system. These sessions were followed by Alpha's business meeting and resolution session. In the afternoon, we participated in discussions on navigating Ontario's political landscape during increasingly challenging times, as well as an examination of the future of public health funding and the challenges and opportunities ahead. We also heard from Dr. Kieran Moore, Ontario's Chief Medical Officer of Health, who provided updates on current priorities, emerging public health issues, and key provincial initiatives impacting local public health agencies. As I had to return to Ottawa for a City Council meeting, I was unable to attend Wednesday morning's Board of Health section meeting. However, Vice Chair Di Giovanni attended on behalf of our board, and I would now invite her to provide a quick overview.
Thank you, Chair. I did have the opportunity to attend the Wednesday morning Board of Health section meeting, which featured presentations on the current governance landscape and the opportunities presented by upcoming municipal elections and board transitions. The sessions also explored legal frameworks related to board appointments, authorities, and accountabilities, as well as approaches to embedding health promotion principles into governance practice, support focus, engagement, and effective leadership. The delegates additionally received updates from the Association of Municipalities of Ontario and from Alpha on strategies for building high-impact and skills-based board. And I'd like to thank the Board of Health for supporting my attendance at the conference.
Thank you very much, Vice Chair. This was really just a brief overview of the conference proceedings, but we thought it was important to bring it back to the board to share. And pursuant to the board's travel policy, we will prepare a more detailed update through an information previously distributed memo. I would also like to thank the Vice Chair for taking time out of her busy schedule to participate in the conference. It really is an invaluable opportunity for both the learning and networking, and I encourage all board members to take advantage of this experience at least once during their term or in future terms. As well, I want to thank OPH staff for preparing briefing notes on each of the resolutions that were being considered by Alpha delegates. It was extremely helpful in informing and guiding our votes. Finally, I would like to note that during last week's meetings, Dr. Arneson was approved as chair of the Council of Ontario Medical Officers of Health, also known as COMO, for the 2-year 2026-2027 term. So congratulations to Dr. Arneson on this appointment. I know your leadership in this role will be invaluable and in supporting collaboration across Ontario's public health system, maintaining a strong organizational integrity among public health unit leadership, and advancing consistent decision-making and cross-sector partnerships aimed at improving public health practice across the province. And finally, as we approach the summer months and the conclusion of this season of meetings, I want to extend my thanks to all board members for your ongoing dedication and commitment. We will not meet again until the fall, and so I hope each of you is able to take some time over the summer to rest and recharge. Maybe easier said than done for my council colleagues. At this time, or at the same time, as we come closer to the end of this board's term, the work ahead remains important. The conversations we will continue to have in the months to come will help shape the path forward for Ottawa Public Health and for the next board. It has been a privilege to work alongside each of you, and I look forward to continuing this work together when we meet again in September. This concludes my verbal report. I would be happy to take any questions. Seeing none, is this item received? Wonderful. Thank you, everyone. On to our Medical Officer of Health verbal report.
Thanks very much. Good evening. Kwe Anusakut Tanshi Ani. Bonjour. I'd just like to note my camera on my computer is not working, so if people are looking to see who's talking, I'll be on the central camera. I'd like to begin this evening by echoing the remarks that were just shared about extending sincere gratitude and appreciation to Inuk Elder Ripa Evik Carlton for lighting the Kulik to open and close today's meeting. The Kulik is far more than a ceremonial object. It represents warmth, light, and community, and its presence here reminds us of the enduring strength and knowledge of Inuit culture. And I also appreciated the words from Kirsten Dumont as well. Was a wonderful way to start today's meeting in Indigenous History Month. This year's observance feels particularly meaningful as communities across Canada continue to advance conversations and actions towards truth, reconciliation, and health equity. À Santé publique Ottawa, nous restons engagés à intégrer ces principes dans notre travail grâce à des partenariats respectueux, des services adaptés aux cultures et des actions pour réduire les obstacles systémiques à la santé. I encourage members of the public, our staff, and this board to take the time this month to participate in local events, amplify Indigenous voices, and find meaningful ways to reflect, learn, and celebrate National Indigenous History Month and the summer solstice on June 21st. As we move into the summer months, I would like to take some time this evening to speak about how residents can make the most of the season while staying safe and healthy here in Ottawa. This is a time of year when many residents are eager to enjoy Ottawa's parks, waterways, festivals, and outdoor spaces, and we want to ensure that everyone can do so safely. A key area of concern this season is drowning prevention. With increased activity around pools, rivers, and lakes, it is critical to emphasize constant attentive supervision of children near water, the use of life jackets, and awareness of changing conditions in natural bodies of water, such as the Ottawa River. We are working closely with our partners to amplify these messages across the city. At the same time, we join our first responder partners in the Ottawa Police and paramedic services in reminding residents to take steps to stay safe at home. Well, summer is a time of openness and fresh air. It's important to ensure that windows and balconies are secure, particularly in homes with young children. Simple measures such as keeping furniture away from windows, doors, and railings, ensuring barriers such as window stoppers, locks, or guards are in place to prevent windows from opening widely, and locking balcony doors can make a difference. Ces rappels visent à prévenir les accidents. Nous encourageons les familles à prendre un moment pour vérifier la sécurité de leur demeure. We are also continuing our Party Safer outreach throughout the busy event season. Ottawa Public Health teams will be present at many community events, providing information on Party Safer tips, offering support and training for those that are eligible on naloxone. And we had some members of the board join in discussion and learning about Party Safer and learn about naloxone last Friday. This is to ensure that people can enjoy these celebrations while reducing harms associated with substance. I encourage residents to seek out our booths and connect with our staff who are there to support safer choices and answer questions in a non-judgmental way. If you want any more information on this initiative, you can also go to partysafer.ca. There's a wealth of information there. We're also thinking about heat. Heat is another important consideration in the summer season. As temperatures rise, residents should take steps to stay cool and hydrated, check in on neighbors, be mindful of the impacts of heat on their pets and their loved ones. Residents are encouraged to take advantage of air-conditioned public spaces across Ottawa, including libraries and community centers, as well as outdoor options like splash pads and pools, and to consult the city's interactive map of places to cool off when planning their day. Wearing sunscreen, seeking shade, and planning outdoor activities during cooler parts of the day are simple but effective strategies to prevent heat-related illness and sun exposure. And that's such an important message. I'll repeat it in French. Utilisez de la crème solaire, restez à l'ombre et planifiez les activités extérieures pendant les heures plus fraîches sont des gestes simples et efficaces pour prévenir les effets de la chaleur et du soleil. I would also like to provide a brief update regarding the Ebola disease outbreaks that have been declared in the Democratic Republic of Congo, also known as the DRC, and Uganda. At this time, there are no suspected or confirmed cases in Ontario, and the risk to residents in Canada remains low. Federal quarantine measures are in place as of May 30th until August 29th for travelers returning from affected or high-risk areas, which includes the DRC, Uganda, and South Sudan. The Ministry of Health, Public Health Ontario, and the Public Health Agency of Canada are leading the response and coordination across local health system partners, including OPH. Nous continuons de suivre la situation et d'appuyer les efforts de préparation au niveau local. Cela inclut l'évaluation des risques et la surveillance des symptômes chez les voyageurs de retour et le partage des directives provinciales avec nos partenaires du secteur de la santé. June 12th marked the closure of Ottawa's 2 remaining supervised consumption and treatment service sites operated by Ottawa Inner-City Health and the Sandy Hill Community Health Centre. This is an important and challenging moment for our community. Last month, Clara Frere, General Manager of Community and Social Services, and I issued a joint memo to Council and the Board of Health outlining expected impacts in the coming months and the steps the city is taking to mitigate them. With the closure of Ottawa's CTS sites due to the suspension of provincial funding, clients are expected to face increased risk of overdose and related adverse health outcomes, while creating additional pressures on emergency responders, hospitals, and community health and social services. The closures may also contribute to increased visible drug use, public safety concerns, and discarded drug equipment, placing further strain on municipal services. In response, OPH has been working closely with the city's Frontline Municipal Response Task Force, which is focused on finding cross-departmental municipal solutions to issues impacting the municipal services, like police, paramedics, transit, and waste collection. We have also been working closely with the local Ontario Health team to convene community service provider partners in the health and social sectors to look for mitigation options through what we're calling the CTS Mitigation Response Planning Table that's meeting weekly. OPH remains committed to ensuring that organizations and community members continue to have access to naloxone, overdose prevention resources, and safer drug use supplies. Harm reduction services, including supply distribution, naloxone training, and kits, continue to be available through OPH and over 45 community partners across Ottawa. In coordination with OPH, the Overdose Prevention and Response Task Force will continue issuing drug alerts to the public as needed, and anyone can sign up to receive these alerts at stopoverdose.ottawa.ca. I strongly encourage you all to sign up for these. Finally, I'd like to take a moment to recognize that June is also Employee Appreciation Month at Ottawa Public Health. Earlier this month, OPH staff gathered to celebrate our collective appreciation for one another, and we will continue to do so throughout the month. I also had the honor of attending the City Manager's Awards of Distinction ceremony last Friday, where many OPH employees were nominated across a range of categories. We're all very proud. It's incredibly rewarding to see our colleagues recognized for their outstanding contributions and the meaningful impact they have on the health and well-being of our community each and every day. Le dévouement, l'expertise et la compassion de tous nos employés sont au cœur de notre travail, que ce soit en inspection, en épidémiologie, en promotion de la santé, en communication, en préparation aux urgences, en élaboration de politiques et bien d'autres. Nos équipes travaillent chaque jour pour protéger et améliorer la santé des résidents d'Ottawa. Leur impact se fait sentir dans chaque quartier et au sein de chaque communauté, souvent de manière invisible mais essentielle. I'm continually inspired by the commitment, innovation, and professionalism, and I would like to extend my sincere thanks to each and every member of our organization, and that includes the Board of Health members for their work they do every day for OPH. Thank you very much. Merci. This concludes my verbal report, and I would be happy to take any questions.
Thank you very much, Dr. Arneson. Member Bauer.
Thank you, Dr. Arneson, for your report, and my thanks as well to the team, OPH team that did the Party Safer presentation last week. It was quite an impressive demonstration of a very small team doing amazing outreach at many festivals, events across the city. It reinforced for me that many individuals use substances in one way or the other at certain times in their lives. And unfortunately, as you mentioned, the most vulnerable of which are now in a more precarious situation as of last week due to the closure of the safe consumption sites. Given the mitigation measures that you mentioned with the task force and the Ontario Health Team, I'm wondering if the board, I think the board would appreciate maybe a report in our September meeting on sort of the short-term impacts. We've had a few months to assess some of the community impacts, some of the health systems impacts, and the impacts, of course, on individuals themselves.
Thank you for that that comment and that suggestion. I think a number of partners have brought forward the notion that the work that Ottawa Public Health does in surveillance is very important. It's very important at a time like this. But the information that we collect routinely as it relates to the overdose crisis and have been for many years through many different methodologies is just one part of a broader story that needs to be captured, especially right now as things are changing rapidly on the ground. So the Ottawa Health Team, Équipe Santé Ottawa, has been very helpful in working with us to talk with the frontline service provider agencies around how they can collect information that we can record going forward to document what's going on. So that work is getting off the ground with the group I just mentioned, and we will have something that we can provide an update on certainly in September. This has also come forward at the Frontline Municipal Task Force, and the city's Community and Social Services Department is putting some resources through their data collection and analysis unit to look at impacts on various city services, which I also anticipate will have some information that may be useful around later in the summer into the next board meeting in the fall. So I think we can certainly look to provide some update on the situation.
Thank you very much.
Thank you, Member Bauer. Member Chung.
Thank you. Dr. Arneson, you mentioned water safety, and I've noticed, in the media recently, there's been quite a few unfortunate incidents surrounding young children and water, and quite early on in the season. Just wondering are there any trends that you've seen from these incidents? Is there anything that Ottawa Public Health can do? Say like cross collaborations with the recreation unit. I know that a lot of families try to get swimming lessons for their children, and it's very difficult, and they can't afford private lessons. So I don't know if there's been any consideration for cross collaborations that way, but just wanted to get your thoughts on any trends and anything Ottawa Public Health can do.
Thanks very much for the question. In terms of drownings and near drownings, it's a little bit more complicated in terms of having exact numbers. There is not a active surveillance system for drownings in the Ottawa area. It's not a disease. It's not one of the diseases of public health significance like infectious diseases that under the legislation we monitor routinely. In terms of drowning deaths, they would be reported through the coroner. And oftentimes those statistics and information has quite a bit of a lag. And so we do hear about instances in the news and through our partner organizations, and that does raise concerns. As the team knows here, I would like to bring it up frequently that we need to consider anything we can do to contribute to reducing the risk of drowning and promote water safety. And we have wonderful partnerships with the paramedics, fire services, police, and we did a promotional message last month, which was very well received. And we've continued to see incidents that we would like to prevent in the future. I think the big other big partnership is through Parks and Recreation, which is actually called Recreation and Cultural Facility Services here at the City of Ottawa, that we meet with regularly to discuss things like the recreational water, the beaches operated by the city. And I think the big message that often comes out of those meetings is that people need to look for supervised locations for swimming. So the beaches in Ottawa are supervised, particularly for those individuals who may not have strong swimming skills or may be developing them, which is most children. And we have to be conscious of the fact that the Ottawa River is an open body of water, as well as the Rideau River, and supervision of children is extremely important. But we can all do our part in the community of promoting that culture of supervision and water safety around watercraft, around our many beautiful waterways, as well as the use of life jackets. And then as well, we are promoting swimming skills and swimming lessons, and working with the Life Saving Society on their promotional messaging as well. Thanks.
Thank you.
Member Chung, did you have any other questions?
Thank you. No.
Thank you. Is this item received? Wonderful. Thank you, everyone. Item 11.3, Ottawa Public Health's financial stability. So we are going to have a presentation on this item. So we'll invite Kibria and members of your team up to the mic. Thank you. While Kibria gets set up, we are going to have some opening remarks on this item from Dr. Arneson.
Thank you very much, Chair. So Kibria is going to take us through the core recommendations and options that have been outlined in the financial stability report that you've seen. But before he maps out that path forward, I just wanted to take a brief moment to provide some context. The report really sets out the realities of what Ottawa Public Health is facing in relatively stark terms. Under current assumptions, OPH projects its annual operating deficit will grow from 4.5 million in 2027, so next year, to 14.7 million by 2036, if there's no additional funding or structural changes are made into how we are budgeting each year. So this isn't meant to be a worst case scenario, but really just looking at what, if we continue on from our current funding conditions, what we can expect in the future for planning purposes. In the years following the COVID-19 pandemic, we have done significant organization-wide service reviews to identify efficiencies and act as strong financial stewards of resources for the benefit of the health and well-being of Ottawa residents. And we also know there were significant investments and a lot happened during the COVID-19 pandemic where provincial vaccine investments were made. Today, what we're talking about is our look forward into the future and how our long-range financial outlook shows that we will really need to continue to look hard for efficiencies, but also make changes likely in how we work and really seek out more sustainable solutions and a sustainable path from our funders and in our planning. And this is just simply to maintain our mandatory programs and services under the Health Protection and Promotion Act. So we will need to continue to work collaboratively with the Provincial Ministry of Health to develop a long-term model to fund cost-shared programs, but also to meet the growth of the population and service demand pressures due to the increasing complexity of serving a growing and a population across Ottawa. But we'll also need to demonstrate value and impact of our public health services to the people of the province and the healthcare system. And we'll need the City of Ottawa's support as well, so our teams can keep delivering on the priorities that residents and partners have asked of us and to uphold our reputation for service excellence. Public health improves the quality of life for our youngest, oldest residents around the clock in every community from the heart of downtown to rural neighborhoods. Looking at today's agenda, we see how residents and partners rely on us for expertise, programs, and services in so many areas that have a real impact on their lives. We are committed to meeting the evolving and growing needs of our community, and this report is meant to lay the groundwork towards the goal of bringing long-term financial stability to the organization and the people we serve daily. So I'll now hand it over to Kibria, who can walk us through a bit more of the detail of the report. Thank you.
Thank you, Trevor. Good afternoon. Thank you for your time today. I'm here to present OPH's Financial Stability Report. This report has been developed over several months. It is based on data analysis and a clear view of our current financial position. Today, I will walk you through 6 areas. Number 1, what financial stability means for OPH. Number 2, the funding context. Number 3, our long-range financial outlook. Number 4, actions already taken to strengthen financial stability. And number 5, strategic options for board consideration today. And lastly, a set of recommendations with next steps. We had the opportunity to engage with most board members during our annual retreat, and we provided a detailed presentation on this topic. This version has been further streamlined to keep the discussion focused on the key points and decisions before us. Before we look at the numbers, I want to be clear about what financial stability means for OPH. It comes down to 2 conditions. First, a sustainable balance between cost and revenue. In simple terms, our funding must cover the full cost of our programs, not just this year, but every year. Second, our workforce gap must stay at a manageable level, which is around 3%. Workforce gap means positions that are temporarily unfilled as staff move in and out. Some gap is normal, but higher levels create pressure. When either of these conditions is not met, it affects our ability to maintain programs, retain staff, and plan properly. Right now, we are off on both. Looking ahead, operating costs are expected to grow by about $3.4 million per year. This is an average projection over next 10 years. While revenues grow by about $2.2 million. This creates a structural cost revenue gap of roughly $1.2 million each year. The next slide examines the funding context shaping OPH's financial stability. OPH's financial stability is shaped by the way different programs are funded through different funding streams and how the province and the city work together within that structure. There are 3 program categories, each with a different funding structure and risk profile. The first category is cost-shared programs, which represent about 83% of total operating costs. They are funded through a 75-25 cost-sharing formula split between the province and the city. They are also the most vulnerable category due to the complexity of the funding arrangement between the province and the city. The provincial funding for these programs has grown at about 1% annually, while city funding has grown at about 4.3%. The second category is 100% provincially funded programs. They represent about 11% of the total operating costs. These programs receive largely static funding, with few exceptions, and annual growth funding has not been consistent. The third is 100% city-funded programs. They represent about 6% of the total operating costs, and these are funded entirely by the City of Ottawa. Together, these 3 categories show how different funding flows across programs, and that difference is an important point for understanding how funding gaps emerge over time. With this funding context in mind, let's turn to OPH's long-range financial outlook. And the outlook is built on these funding realities and a set of assumptions about cost, revenues, and staffing. The foundational assumption here is the current services continue as is, without growth or expansion. On the cost side, we assume that the salaries will grow annually on average by 3%. Benefits will grow by 6%, and other costs will grow by 2.5%. On the funding side, our assumption is about 1% growth in provincial cost-shared funding, no growth for fully provincial programs, and about 4.3% growth in city funding. We also assume that workforce gap improves from 4.7% to 3%. What does it mean? It means it adds about $700,000 in cost as positions are filled. Finally, we treat the outcome of the provincial funding formula review as uncertain. Using these assumptions, we can now examine where OPH's financial outlook is projected to go if current conditions continue. This slide shows the long-term financial outlook. The blue line shows the cost, the top one. The orange line shows revenue. The gap between the 2 lines is the deficit. In 2026, the deficit is about $2.2 million. By 2027, it increases to $4.5 million. And by 2036, it reaches $14.7 million. The key message is simple. if the current conditions prevail, the cost revenue gap grows every year. It does not level off. Over time, this level of gap would directly impact programs and services. Well, this slide shows the detailed numbers behind that chart. I will not go through each row, but it supports the trend we just reviewed. The question then is, what OPH has already done to address this challenge? The next slide summarizes the actions taken to date. On the revenue side, we continue to remain actively engaged with the province on funding formula review. This process was launched a couple of years ago as part of the provincial strategy to strengthen public health in Ontario. We have also secured some additional time-limited funding, such as Ministry of Solicitor General support for Needle Hunter program. But this funding is temporary and will end in March 2027. We have also received some one-time in-year provincial funding to offset budget pressure, but this is declining and not reliable year to year. On the cost side, between 2022 and 2023, we completed an organization-wide service review. We redirected $9 million in cost efficiencies to support priority programs that would otherwise have gone unfunded. This represents significant internal restructuring and managing growing service demands by finding cost efficiencies within existing operations. In addition, several operational efficiency initiatives are currently underway, including clinic relocations, vaccine storage consolidation, dental service redesign, management restructuring, and shifting certain functions to relevant partners. These are meaningful actions. However, as the forecast demonstrates, they are not sufficient to close the structural cost revenue gap on their own. That leads us to strategic choices available moving forward. We are presenting two main options today. First, a revenue anchored option. It involves the board formally requesting that the ministry to increase their contribution to cost share programs and introduce annual funding adjustment aligned with cost growth. This is not a new request. The board has already been advocating for it. What is being sought today is formal direction from the board to continue and strengthen that advocacy. Second, a cost-anchored option focuses on preparing OPH for more difficult decisions if funding situation does not improve. This would involve undertaking a targeted service review to identify programs and services that may need to be modified or discontinued. The findings could be presented to the incoming Board of Health in 2027 for consideration. The review would look at programs that are not required by legislation, areas where others could deliver services, programs with lower impact compared to cost. Any consideration of program discontinuation would be the last resort and only pursued if funding challenges persist and additional revenues are not secured. Given these options, we have developed a set of recommendations for the board's consideration today. We are asking the board to direct OPH staff to continue efficiency and spending review, move forward with a targeted service review, and report back in 2027 with findings and updated financial outlook. We are also asking the board to authorize the board chair reaching out to the Minister of Health seeking increased base funding and a more sustainable funding model. This approach allows us to manage both sides, cost and revenue. If the board supports these recommendations, the next slide outlines how we move forward. If approved, the next steps include 3 milestones. First, today, the board direction and approval. Second, over the coming months, continue efficiency work and complete the service review. And third, in 2027, we report back with results and options. With those next milestones in mind, I conclude my presentation by returning to the key message from today's report. OPH's structural cost revenue gap is projected to widen, reaching $14.7 million by 2036 if no action is taken. This imbalance cannot be resolved through internal efficiencies alone. Closing it will require coordinated action from the board, the province, and the city. The decisions ahead will be critical to sustaining the programs and services that underpin our community's health, protection, and well-being. Maxine, thank you.
Thank you very much, Kibria, for that comprehensive presentation. We'll open it up for questions from members. Member King.
Thank you, Chair. And I also really wanted to thank staff for the in-depth discussion that we had at that annual strategic and financial planning session, where we were able to talk about the structural gap and, really get some in-depth insight into the concerns that Ottawa Public Health has in terms of addressing the gap itself. I'll obviously be supporting the report, which makes recommendations that include undertaking a target service review. Just wanted to have a sense about that service review. I know under recommendation 2, it says it will identify programs potentially eligible for reduction or discontinuation. Can staff provide any early indication of which program categories are likely to face scrutiny? And will equity and social determinants of health be formal criteria in that review framework?
Thank you for the question and your support. Right now, we don't have any idea which program will be affected. We are in a very preliminary stage of conversation. We have a few criteria we already shared in the report, but in addition to that, we have other criteria that includes equity. Is one of the important one because it is one of our foundational criteria for our strategy. I like to reiterate here is that Ottawa Public Health operated with this constraint budget pressure over the last 15 years and only increased the total FTE by 6, number 6. So over 15 years, we have grown by 6 FTEs. What does it mean? It means an excellent level of efficiencies we could achieve by relocating resources. And sometimes these are not visible because they are not in any report that we did efficiency work. So I want to reiterate that. So our objective is not to reduce any programs or services because we believe that it is important to maintain what we have. We are currently operating understaffed, I would say, in general. We wish we could have more FTEs because our service demand has grown over years due to population growth, due to complexity in the community, to serve the community, as you mentioned about equity issue. Health inequity is a big issue. But we want to follow a more systematic approach by doing service review and demonstrate that why it is important to maintain services. I think that's the key behind service review. So I want to take this positive message to everyone that service review does not always mean that our intention is to cut programs. That's the last resort. If we cannot solve the funding problem, I would like to, Trevor to add to that.
Yeah, I'll just add that, public health work does evolve over time. And, in the past, we have looked closely at what the province mandates under the Health Protection and Promotion Act and through the Ontario Public Health Standards. We're getting a pretty good idea of what the renewed public health standards will include and focus on. So it is an opportunity to look coming out of multiple infectious disease concerns, see where the current requirements are and where we might be not meeting them as much or not being held to the same level as in previous due to shifting provincial priorities, but more so just the landscape of how things are evolving in the public health world in terms of how we work and where those efficiencies might be. But central to that too is the consideration of health equity and social determinants of health. And as we've talked about in the strategic plan, much of that is foundational and core guiding principles for everything we do and for the standards. So that would be an important consideration in any action we take to relook at the services we're providing and where we're investing and disinvesting.
I do appreciate that answer, and I know the hard work that Ottawa Public Health as well as this board has taken in terms of attempting to address equity in communities. I mean, we see it every day, neighborhood health hubs and other initiatives that have been undertaken by OPH, and obviously equity is embedded into our service provision and into our methodologies. And I think, since Ottawa is growing, as you had noted in terms of our population, it's important that communities that most likely would feel the impact of any type of program reduction, though I know that the aim is to retain as much as possible and to continue on with programs. Obviously, people who would be affected by any program reduction would be the least able to absorb those reductions. So I think any service review framework must include a health equity lens, and I'm happy that you're committed to that. My final question, since you did talk about the efficiencies piece and that's not always a focus, I know that the report, and you reiterated it in your presentation, noted that OPH secured $9 million in efficiencies in its 2022-2023 service review. I'm just wondering how much additional efficiency is actually realistically possible, and at what point do cuts begin to compromise legislative public health standards if we are not able to fulfill the gaps?
Thank you so much for the question. I think it's very important for all of us to reflect on it, that how much more efficiency is possible. I think most of you notice that every budget cycle, we present budget and there is a request or requirement from the city to demonstrate efficiency. We do have a city policy and report supports that. We continue finding efficiency every year. As an overarching theme, if I want to comment on how much more is possible, I would say we are really at the edge, on the edge, I would say. More efficiency will only lead to more stressful situation for our staff. We do have requests to recruit temporary staff sometimes because of the workload, and we simply don't have resources to do that. But there is a service demand in the community. I think what we could achieve so far, even this year, some of them actually we noted in the report, some of the efficiency work. I don't think there is more to do there in terms of efficiency. That's what I can say.
I'll just add, yeah, I think, efficiencies, we're working on them all the time. It's an ongoing process, and this board and OPH have a history of doing a very good job of finding these as the work evolves, as I mentioned. However, I think we're bringing this report today because we really want to make people aware that it grows more challenging every year, and the idea that year over year we're going to find efficiencies is really not a sustainable long-term plan. That's why we're laying the groundwork for thinking beyond those yearly and regular efficiencies that we're looking for. And this is also another very good point that you made around the maintaining our core mandate under the standards and the Health Protection and Promotion Act. It's not really a binary outcome of you're either meeting all your obligations or not for a lot of areas. As you know, the work we do in health equity and health promotion, sometimes it's nuanced and requires a bit of additional effort and resources in areas or in partnership work that may be very different in another health unit or another context, or maybe different year to year. So we really need to focus on this sort of long-term planning and the idea that we're sort of operating in the same sort of situation of employee numbers that we have for many years, and recognizing that our city has changed quite a lot in that time in terms of population, but also people coming from all parts of the world, which have different levels of health and different needs that they want to see, and also we have a reputation, as I mentioned at the beginning today, of service excellence, and we want to maintain that for the city and the residents of Ottawa.
Well, I appreciate that answer. I think the reality is that there are only so many efficiencies that we can find as an organization and as a board. So we need to address the revenue gap to meet our obligations. And that's one of the reasons why I will definitely support this report, which is seeking to really drive more advocacy towards the province with the letter to the minister. I strongly support authorizing the chair to send this letter, and I would encourage us to be direct and unambiguous in its tone. The province committed to covering 75% of cost-shared program costs. In practice, that commitment has eroded to roughly 56%, which we've heard in this presentation. That gap, approximately 13 million, represents services, staff, and public health capacity that our community is not fully receiving despite the statutory obligation to deliver it. And so the province made a commitment. It has not kept that commitment, and we are asking them to honor it. not to do us a favor, but to fulfill an obligation to the residents of Ottawa. Thank you, Chair.
Thank you very much, Member King. Just a quick comment to build upon that exchange. 6 FTEs in the last 15 years. Ottawa has grown by more than 250,000 people in that time. The 2011 census had us just under 900,000, and we expect we're well over 1.1. The 2026 census will confirm that. But just to put that all into perspective, thought that was important to share. Member Dudas.
And thank you very much for adding that, Chair Kitts. I mean, I get very squeamish talking about finding more efficiencies with OPH when we know that you've barely grown to even meet the demand. You can't even meet the demand of our growing city, let alone think of the future and our increasing needs. So, I appreciate that segue. I do wonder, and I apologize if this was mentioned, what are other public health units across Ontario dealing with in terms of this? Are they facing the same circumstances in terms of this financial crunch?
Thank you for asking. According to our observation, this is not only OPH specific issue in terms of deficit that we see in the public health sector. It is across public health units, and ultimately it is the municipality who supports to fill any gap for all other public health units. So we are not alone, I would say. But how different public health unit works with different municipalities, it depends on the governance structure. As you know, our governance structures are not same. Some are semi-autonomous units, some are fully independent, and some are more integrated, like us, with the municipality. So how that relationship works, how that funding works, it little bit differs between municipalities due to governance structure. But ultimately, everybody is on the same boat. When I talk to my colleagues from other public health units, some of them are in a better situation because they are remote. Their funding share from the province is much higher than what we receive. And this is historical. This is nothing new. And province has promised to address these discrepancies. We are currently working with them.
How amenable does the province seem to be in terms of our ask for increased funding, increased support? I mean, I know we're about to ask we're about to support that increased advocacy, but do they seem to be open to that discussion?
I'll just add around the previous answer, which I think goes well into this one. So each public health unit is set up a little bit differently, and we're actually, the relationship we have with the municipality of one municipality is actually relatively unusual across the province. Most are made up of multiple municipalities and have an independent board of health. So in many ways, the province has a bit of a challenging job when it comes to providing what they see as equitable funding across the province, because each different board has different structures and the way they are the way they pass their budgets and fund, and we have to appreciate that some rural northern health units situations are very different than ours. I think what makes our situation in Ottawa a bit unique in this moment is rapid population growth and certainly immigration into Ottawa over the last few years, meaning that we're facing complex public health problems and need to address inequities that we haven't in the past. So that's one of the reasons that the province, may be trying to have a one-size-fits-all formula that is very hard to take into account those changes in different locations. So I think, we talk to the province regularly, and the province is very open about some of these challenges as well, in terms of ensuring that the health units across the province are using the funding that they're given adequately to meet the standards in their local context. And they've been talking recently about supporting us more in terms of how we can measure those things as it relates to the services we're providing, so that we can have better comparisons. I wouldn't say that the issue we're facing around funding is universal, and we've talked to the province and the minister, and there is ongoing discussions around funding formulas for public health units, and those will continue. But the province is really seeking to have a comprehensive system for the whole province around funding to going forward as well. So that's why it's an important time for us to reiterate as a board that we're committed to that conversation at the provincial level, because it will be important.
I appreciate that. I do hope that they realize that the one size does not fit all when it comes to public health units and the communities they serve. And I hope they also realize that every dollar they give us is not generous, it's investment, because there's value in the services that OPH provides. I mean, the Canadian Public Health Association estimates that every dollar spent on public health saves about $7 to $10 in future healthcare and social costs. I mean, the value is there. And if they're looking at only dollars and cents, the money is there in terms of saving. So I want to absolutely share my support for staff's direction, and Chair Kitts, I know how much advocacy you put into the work that you do, and how much effort you do to get the message across to our provincial counterparts. So keep up the good work. That's it for me. Thanks.
Thank you, Member Dudas. And I will just share from a board advocacy perspective that rapid growth of Ottawa does seem to, in our conversations, there is some acknowledgement around that. But it seems to have gotten stuck in the implementation of a model, as Dr. Arneson was describing, and has really hinged on that funding formula review, which has not progressed, I guess, as quickly as we would like. So we'll continue to advocate. Member Bauer.
Thank you, Chair, and thanks to staff for the very comprehensive report. Fully support the recommendations in it. I'd like to focus on two points in the report. The first is on our primary cost driver of compensation and benefits, 9% annually. I realize, or I understand that that is tied to collective agreements with the city and its employees, so a bit out of our control. But just curious about the assumption of a 6% benefit increase year after year after year. If you have line of sight on that in terms of what is driving that increase in benefits to that level. I only mention it because the federal public service has the same challenge in terms of cost containment around its compensation benefits packages. So we call it the 5% challenge. This seems to be a 6% challenge, but if you could give us perhaps a bit more context to that cost driver.
Thank you for the question. The 6% benefit is part of the negotiation normally union has with the city. So it's there are two pieces here. One is the compensation increase, that's 3%. and 6% benefit applies to any employee benefit budget that we have, and that includes employees, all associated benefits like long-term care, long-term disability leave, OMERS, and other other associated benefits that we have. Is a full package. 6% is an average observation that we have over the last few years. This may go down or up, fluctuate a bit. It's just an average.
Yes, and I think there have been studies, at least at the federal level, about an aging workforce and increased mental health claims. So I was wondering if there are dynamics that are comparable at the city level that may be driving a 6% assumption.
So far, I mean, from our observation of the HR analytics, we don't notice any red flag or anything skewing the data. They're pretty much standard. We are coming out of pandemic over the last few years. So during pandemic, data was different. But we don't see anything to be alarmed. I can say we do review the employee data every quarter. The number of the employee reaching out for support, number of employee on leave, vacancy rate. We don't really see any trend that is alarming. So we don't know how the union will negotiate those benefits going forward. There are other factors probably we need to take in consideration. Factors like regional and local factors sometimes affect those negotiations. You need to look at the overall economic situation in the country and other costs that rise. So all of them affect how the union negotiate, as you may have already experienced.
Thank you. My second question revolves around the targeted service review, and I was encouraged to read the top of page 10 in your report, the reference to service level costing. So I think in previous comments, we've referenced there may not be a lot of room to squeeze on additional programs and services, but how we do our work at OPH is perhaps an area for exploration, and costing and benchmarking is key to that. And again, just curious about the maturity of that costing analysis that we have vis-a-vis, again, other provincial health units, because it can be a very powerful way to drive efficiencies while maintaining your existing program and service suite. And often it's the staff themselves that are able to really identify efficiencies in that regard.
Thank you for asking this question. We started having this conversation about costing per service, costing of even the impact we make in the community. So we recently completed a return on investment study, actually, of one of our service areas in collaboration with the University of Ottawa. I'm currently reviewing that report. We are also in conversation with our quality and epidemiology department, how best we can capture those costs and how best we can develop aggregate cost that we can measure the impact, the cost of impact. So for example, what does it mean for us to vaccinate one child, how much it costs? Yeah. So that we can visualize that what we are investing, what we are getting out of it. This work has been ongoing. And this, I would say we need to be mindful about the timing, that how much time it takes, because these are additional work that we don't have resource to allocate. So only to do ROI analysis, we could not allocate any resource. We had to rely on university's resource and some additional grants. So we need to be mindful about timing. Trevor is, I think in the last board retreat, Trevor highlighted some of the ideas that we are currently thinking, and Member Giovanni, you are also, I think, talking to Trevor that we want to learn from other sectors too, like hospital sectors. The challenge with public health sector is that in the hospital sectors, costing against output is easier because you can count the clients. In public health, we are talking about making an impact which you cannot see now. You can see in future. We are talking about prevention, which is the most challenging thing to visualize. We learned this while we were doing ROI. So this is an ongoing process and ongoing activities. We want to continue this.
Thank you. Yeah, I think you've hit the nail on the head of the discussion topic we've had with the others across the province and with the province. And the province needs to be commended for their bringing this forward and support, offerings to support with bringing us together across the province around thinking more along this way. But to answer your question about how far along that is, surprisingly not very far along in terms of understanding, what the cost per service should be in different areas. And we are trying to keep in mind that different places have different contexts. But Member Dudas's point that, at the end of the day, we're all united across the public health units in Ontario and the public health sector, that this is a good investment for governments at all levels. It has very good return on investment, especially for acute healthcare. And we need to keep that front and center and continue with that messaging, but then also look at, what can we do to measure what we're delivering and compare so that we can find where there may be even more efficiencies or leveraging ways to do work differently that would actually serve a greater population and maybe reduce inequities as well. Thanks.
Thank you, Member Bauer. Member Gower.
Thank you, Chair. Two topics I wanted to ask about. One was through the targeted service review, will there be opportunities for public engagement, or is there a plan as part of these overall reviews to involve residents in any kind of ahead of any changes or anything coming to the board?
Thank you for that question. We don't have a complete plan yet. We are currently discussing how best we can do the service reviews. We just came up with the idea. We have some preliminary thoughts around that. Whether there will be a community engagement, it depends on the scale of the review or scale of impact, I would say. We do engage community on a regular basis through our community engagement team and collect data from the community, especially around health equity, indigenous health, and other issues. We do this on a regular basis to understand what is happening in the community, what is driving communities' health. So it depends on the scale of the review and the level of impact it might have, and we may decide whether we will engage with the community and to what level. That also includes unions and other relevant partners.
Okay, thank you. Yeah, I do want to encourage you to keep some level of public engagement in mind. I think it's important to do whenever we're updating policy and service. And I also think it could be really important on the advocacy with the province. It feels like we've been talking about the cost pressures for a long time here at the board, but I still don't think that's really resonating, or there's a low level of awareness. The message that the province is only providing a funding rate of 56% when they're supposed to be doing 75%, and now it will result in dropping service areas. I think once the public hears about what service areas may be at risk, there may be a heightened level of interest, and the province pays attention when that starts to show up in feedback to the province or coming up in opinion polls and so on. I'll leave it there. Really encourage you to do some public engagement. But on that 75-25 ratio, it's a policy commitment, not a legal obligation. Are we seeking some kind of legislation from the province to make 75% or whatever number an actual legislated legal obligation? Can we ask for that? Is that legally feasible?
Thank you for the question. I would leave this to the municipalities, the municipal association of municipalities, because this is not an OPH specific issue. Changing the legislation would require engagement with the association of municipalities and the province. So if the municipality requests to change, that might happen. We will benefit from that. But I just don't see how us only can influence that process. It is going to require a province-wide advocacy, and especially from mayor's level or council level.
Okay, thank you. I will follow up offline with colleagues on where we might be able to go with that. Thanks, Chair.
Great, thank you, Member Gower. Vice Chair DiGiovanni.
Thank you, Chair. And I just want to draw attention to the light that we have in the room from our elder who's maintained, I apologize, I can't remember the name, the Canuck. But it's, there's a lot to like here. And so in my glass half full way, I love the fact that as a board member that OPH is looking ahead and raising this risk. So we do tend to go from year to year without really that long range look to say, what is it that we need to be doing to set us up for success over the next 5 and 10 years? And so thank you for the report in taking a look at that. And, there's a lot that we can't control. So we can't control when the funding formula comes out. We can't control, sort of the political flavor. I think we can influence that. But what is in our control is to be looking ahead and to be really thinking through what would we do. It does create, there are lots of assumptions. It's a budget planning document. I was wondering about the 6% and the 3% too, but you have to start somewhere in terms of making some of those assumptions and adjusting them as we go. I do think, and it's to play on some of my my member colleagues, as Member Dudas said, there is power in numbers, and looking at that service level costing, I know it's complicated, but I was happy to see that in the report, because I do feel like what the government is struggling with is it feels like they're invested and they've heard the value for money of public health overall. I do think that that's a bit of a change, that they do see that if they can get ahead, that there will be impact on, the big costs of acute care, and that, I think it's like $1 invested is $7 saved. Like I feel like there's momentum there. Where I feel like we need to make sure that we can help the government is that we're being as efficient with those dollars as we can be. And I think OPH is. It's how we tell that story to the ministry. So by looking at the service level costing and saying, and working with our colleagues to benchmark, to say, look, for a vaccine, here's how much it costs us to give a vaccine. I think we do that pretty efficiently from what I can see. But, to do that benchmarking across on some of those process pieces, it feels like that would really help to reinforce our message to the ministry around the funding formula, because I do think we're getting caught up in the complication of the funding, the various ways that, historically funding has been granted, the different structures across the province. But that really does speak to them, is to say, look, we've done the hard work. It's not perfect, but we do know that we're being as efficient as we can. And here's what we're seeing in the city in terms of that growth. And there's other regions like Peel and others that are seeing that growth as well. And so maybe it's about being selective with our partners in benchmarking. It'll be very challenging to benchmark across the province, but there might be some select areas that we can be, and that feels like that would be powerful in terms of our advocacy for the proper funding for the city. So I commend you on this path. I think it's hard, but it's also very forward looking. And I think we'll be able to make our case to the province better once this is done.
Thank you very much, Vice Chair. Very well said. I don't have a lot to add, but we have been talking about this at the board for some time now. So I really see this report as us showing our homework and to your point, Vice Chair, illustrating being transparent with the public and illustrating the challenges in a more detailed way. So I want to thank everybody for your great questions this evening and your engagement. And another thank you to staff for the great report and for the earlier last month to really talk about this as a board. I won't read all the report recommendations because they were well covered in the presentation, but is this carried? Wonderful. Thank you, everyone. We're going to move on now to, thank you again, Kibria. We're going to move on to item 11.4, and I'll just provide a little bit of context since this is a little bit of a unique situation. There was a motion passed at Ottawa City Council requesting that the Board of Health look at the issue of wastewater testing to, I'll just read this part here. The council, sure. I'll just read. So that council requests the Ottawa Board of Health explore the implementation of a wastewater-based drug surveillance and early warning system in Ottawa as part of Ottawa's response to the toxic drug poisoning emergency. And then there was more detail. So I just wanted to provide that context, and I'm going to pass it over to Dr. Arneson.
Yeah, I have a lot of context for these meetings, but yeah, thanks very much, Chair, for highlighting that. So this is coming on a specific request for action on wastewater surveillance in response to the opioid crisis that originated at City Council through a motion from Rideau Vanier Councillor Stephanie Plante, and that was the motion you were reading just there. Okay, and so. What happened there is City Council subsequently recommended this work be considered by the Board of Health, recognizing the alignment with Ottawa Public Health's existing expertise in surveillance and monitoring. We at OPH want to thank Councillor Plante's office for the work they've done in advancing the issue of surveillance on this issue and the idea of bringing new and innovative methods of surveillance to the public's attention. As outlined in the motion before you, Ottawa continues to experience a toxic drug crisis driven by an unpredictable and dangerous drug supply. And the motion identifies that timely and actionable data on emerging substances is critical to support effective public health and community safety responses. So I just wanted to advise you that along with the epidemiology team at Ottawa Public Health, I've been engaging with Health Canada, the Canadian Centre for Substance Use and Addiction, and researchers locally on this concept of wastewater surveillance testing for toxic drugs since last fall. And in the past, we've been operating a highly successful surveillance system through stopoverdoseottawa.ca, which I mentioned earlier in my opening remarks. And that system relies on partner engagement, ground level information, as well as drug checking. And with the closure of the 2 remaining supervised consumption sites, we're concerned about the impact on critical drug checking services and real-time intelligence about the local drug supply, as that's where much of the drug checking was taking place. As the convener of the Overdose Prevention and Response Task Force, which aims to support, gather, and share information on the impacts of the toxic drug crisis, we are the conveners, OPH, and it's comprised of individuals and organizations representing various sectors, including people with lived and living experience and expertise, community health centers, hospitals, pharmacies, emergency services, mental health and addictions, and substance use health service providers, Ontario health teams at the Regional Coroner's Office, and members from the City of Ottawa. We issue these alerts related to toxic drugs circulating in the community or other information when there's new or concerning trends in overdose harms. So a central element of the local response is making sure that we have this clear, dependable insights into what's occurring in the community. And we're using well-established tools and programs to monitor overdose trends, community-level impacts, and discarded drug-related equipment, which we share through the Overdose Overview Dashboard and our Mental Health and Addictions and Substance Use Health in the Community Dashboard. The motion before you today is asking OPH to leverage partnerships with both the researchers and city partners to explore the utility and feasibility of a wastewater-based drug surveillance program for supplementing current population level data to understand substance use and emerging risks in our community and for informing public health action. We have not done that previously in Ottawa for toxic drugs, but OPH and its partners, including the University of Ottawa and the City of Ottawa, have been recognized as global leaders in wastewater surveillance as it related to COVID-19 starting in April 2020. And OPH is continuing to publish weekly wastewater surveillance results for COVID-19, influenza A and B, and RSV. We've continued this work despite the loss of provincial funding in July of 2024. And we're looking at ways to continue funding that work and to continue that work into the future. So basically, we're committed to staying up to date on advancements in wastewater monitoring and public health surveillance, which would include the drug surveillance concept, because it's a promising tool for identifying trends and changes in this issue. Its use for actions at the local level is still relatively new, and there's a few research questions that need to be considered. But I look forward to updates from the team as we continue to support and collaborate with partners in exploring the utility of this tool and its potential application here. So I'd be happy to take any questions about this specifically.
Thank you, Dr. Arneson. There's a couple things that are going to happen here. So first, we're going to go to Member Chung to read everybody's favorite motion to extend us past 7 o'clock. So Member Chung.
Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 81C of the procedural bylaw.
Is that carried? Great, thank you. And then I'm going to just read out this motion. We're going to put it up on the screen. It differs from the one that City Council members would have seen, and for the benefit of public members. So whereas Ottawa continues to experience a toxic drug crisis driven by an increasingly unpredictable and dangerous drug supply, and whereas timely and actionable data on emerging substances is critical to support effective public health and community safety responses, and whereas supervised consumption and treatment services sites have provided important drug checking services and real-time intelligence on the local drug supply, and whereas recent closures of supervised consumption and treatment services sites in Ottawa are expected to result in the loss of these drug checking services and reduce timely insight into substances circulating in the community, and whereas wastewater-based surveillance may provide population-level insight into trends in substance use and emerging risks, and whereas at its meeting of May 27, 2026, Ottawa City Council recommended that the Ottawa Board of Health explore the implementation of a wastewater-based drug surveillance and early warning system as part of Ottawa's response to the toxic drug crisis. Therefore, be it resolved that the Ottawa Board of Health direct Ottawa Public Health to explore the utility of drug wastewater surveillance for informing public health action, including engaging with relevant academic and clinical expertise in areas such as addiction, harm reduction, public health, and wastewater science to inform the design, evaluation, and funding of a potential program, and collaborating with the city's Infrastructure and Water Services Department to assess the operational feasibility of wastewater sampling, including identifying potential sampling approaches, establishing reporting protocols, and developing notification mechanisms for frontline health and community safety partners. Be it further resolved that Ottawa Public Health staff report back to the Board of Health following the conclusion of their review. So just wanted to get that up for everybody to see, and we will now open it up to questions. Member Bauer.
Thank you, Chair, and thank you, Dr. Arneson, for that context. Fully support the motion, but just to confirm, with the closure of the safe consumption sites, there will no longer be any drug checking service capacity in the city. I know we purchased a very expensive machine at the Sandy Hill Community Health Center when I was on the board there. It's a very effective and immediate way for individuals to check their supply, and just wondering what we're doing with those machines as a city.
So this was our concern and expectation when we wrote the motion and when it went before City Council. We, I don't know if this is my place to say, but we're hearing some very recent developments as of Friday or Thursday that Sandy Hill will be able to continue to do that drug checking using those machines. The reason this is a little bit unclear is because it's a Health Canada has to provide an approval to have substances which are under the Controlled Drugs and Substances Act, which we're testing, and the Consumption Treatment Services had those because the people were using these substances on site. So then drug checking could easily be an adjunct service that they provided. When those services were announced that they were going to cease operations due to lack of funding, there wasn't a clear path other than they could reapply, and we worked with them to inquire with Health Canada, and they did a lot of work proactively to inquire with Health Canada. And it seems that Sandy Hill has been successful, and they should be congratulated on the work to do that. And that was one very small bit of good news we heard at the end of last week. And hopefully they don't mind me sharing it today.
It is good news because I think it is very effective to test what's coming into our community on a very real-time basis. And in that regard, I'm wondering with the wastewater testing, what the time lag would be in terms of finding out if there's a new toxic substance that is coming into Ottawa's drug supply.
Yeah, it's a good point. And that, I think that's why one of the best reasons to support this motion, as mentioned, Health Canada has a program that they're looking at nationally that some people have wondered if there's clear overlap with this. There isn't actually. They're looking at this from a network of locations that they can feed up to provincial and national data. This work is primarily through researchers who've worked in the field of addictions and also in the wastewater detection field to see if there are ways we can leverage this at a local level. And there's, a lot of interesting questions here. I think the more I've looked into this issue, the more questions I have that could be answered. I mean, we're hearing today from the federal chief public health officer that we're seeing a decline in opioid overdose deaths over the past year. That certainly has something to do with the toxicity of the drug supply. I would think is a big factor. But what we know about that is relatively minimal in terms of those fluctuations, and that's what these researchers are really trying to characterize. We can get some information from the drug checking, but perhaps, like we saw with COVID, this will allow a triangulation, a better ability to understand what's going on. And of course, when we talk about new substances, we have to know what those are to test them and so forth. So some of the drug checking information may feed into the wastewater, but the evolving nature of public health, this is a relatively novel method, and perhaps we could look at ways to decrease the turnaround time as it relates to wastewater monitoring, so that it could be very short or theoretically almost instantaneous. So that's what the researchers are talking about and thinking about. So what you may see as a turnaround time for the national program that's being run right now in different cities reflects couriering the substances to a national lab in Winnipeg, which takes several weeks to get back. But that might not be what we're talking about here at all, or there may be ways that they can cut that time down to days or even develop novel methods that would be more timely.
Thank you very much. Member King.
Thank you, Chair. And just two quick questions. I was just wondering if OPH would be initiating specific contact with the researchers who had been identified in the original council motion at the University of Alberta or at the Ottawa Carleton Institute in terms of engagement.
Yeah, so one of the researchers we've been working with since April of 2020 and is the researcher that our Epi and Evidence team has a longstanding relationship with on infectious disease wastewater surveillance. We have regular meetings, touch points about that work, and that will continue. And we've spoken about this a couple times already. In terms of the University of Alberta researcher, we've spoken to them. That's not someone that we had a historic relationship on research work, and we have a research process that we follow. But we have engaged already, and we're ready to have further discussions about this in terms of how it would roll out in Ottawa. And similarly, that researcher has spoken to the local wastewater researchers about the methods that occur here.
I appreciate that. And my last quick question is, will this review assess the potential for the surveillance data to inform not just public health alerts, but our own programming and services?
Yep, that's a good point. I mean, we really, that's the thing that I would say about this particular approach and the research questions that I alluded to earlier is perhaps there are applications beyond what our surveillance system in local public health has been useful for and evaluated for, which is issuing these alerts through Stop Overdose Ottawa.ca and through our partner organizations. I think it's important to remember that it's a lot of our partner organizations, a lot of the frontline service providers in many of the communities who are working with clients that are most reliant on this information, and we're really serving as a connector and a convener. So it would really, I've spoken to the researcher about this, and they're really interested in making the data useful and informative for the people most impacted by the overdose crisis, which includes community members, people who are using drugs, but also community members who are experiencing impacts of the overdose toxic drug crisis in the community, and as well as the frontline service providers who are working too. So I think that's where I see most of the opportunity here and what the researchers are thinking, but certainly with any surveillance system that we use, we consider the public health applications and how it's impacting our services as well.
I appreciate that. I appreciate the fact that this report is before us to really explore the potential of this surveillance. And I appreciate the work that has gone on in the past and that continues in terms of COVID-19 and other wastewater surveillance. I think it's important that we have the potential for rapid notification in terms of changing trends. And I know we've been at the forefront of that in the past and currently. And I'm happy that we're exploring the potential of this. And of course, if we explore that, we want to ensure there's maximal utilization of the data. Thank you so much, Chair.
Thank you very much, Member King. I'm not seeing any other hands, so is the motion carried? Great. Thank you, everyone. Item 11.5, response to notice of motion, Canada Lakes Golf Course redevelopment. As has become our custom in this meeting, Dr. Arneson will provide some opening remarks, then we'll open it up for questions on the report.
Thanks very much. So yeah, this is my last bit of context for tonight. As we discussed the last meeting, this motion, and Ottawa Public Health has now completed a thorough assessment of potential public health risks associated with the former Canada Lakes Golf Course lands. The investigation of environmental health hazards is a core part of OPH's mandate. Each year, OPH investigates a wide range of concerns related to contaminated soil, air quality, water systems, dust, odor, and development activities across the city. These assessments follow established evidence-based processes grounded in legislation, provincial standards, and in close collaboration with municipal departments, provincial ministries, as well as external experts. The Canada Lakes Golf Course review that we conducted reflects this well-established approach. So OPH has reviewed all the information available to us to date, including the environmental site assessment findings, peer review materials, and input from relevant municipal, provincial, and public health partners. Based on this review, OPH has found no indication of a current public health risk to residents associated with the activities going on at the former Canada Golf Course lands and the adjacent neighborhoods. It's important to know that from a public health perspective, risks assessments are based on the best available evidence at a point in time. And it's important to also distinguish between OPH's role in assessing current public health risk and the broader regulatory process for redevelopment. The additional work being undertaken by the city and its third-party consultant, including WSP, reflects the normal phased environmental assessment and regulatory process required to support redevelopment and does not itself indicate the presence of a current public health risk on the site. The city's environmental remediation unit has also required the developer to implement some precautionary measures, including a dust and sediment control plan, and ongoing site management practices to minimize the potential for contaminant release during site activities. In a recent update to committee, the city confirmed that preliminary on-site engineering work undertaken in March and April 2026 has been completed, and that additional environmental site assessment work will be required as part of the record of site condition process. Redevelopment of this site, as all sites, follows a comprehensive and highly regulated framework established under provincial legislation and municipal planning requirements. This process requires the developer to conduct environmental investigations, address identified contamination, and demonstrate that the site is suitable for its intended residential use before development may proceed. The Ministry of Environment, Conservation and Parks establishes the applicable environmental standards and reviews and acknowledges a record of site condition prior to redevelopment advancing. The environmental assessment process under this legislation is important for the protection of public health. The requirements are enforceable under Ontario law and include multiple environmental and health protective checkpoints. There is no routine role for local public health to become involved or conduct assessments, as the health protections are baked into the process of these assessments. Oversight of this work on this site is currently led by the City of Ottawa through its Planning, Development, and Building Services Department, with technical expertise being provided by the city's Environmental Remediation Unit and independent peer review provided by a third-party environmental engineering consultant, which is called WSIP, as I mentioned before. OPH is confident that the regulatory framework provides appropriate safeguards to protect human health and that our municipal and provincial partners are exercising due diligence within their respective mandates. Within this context, Ottawa Public Health has acted in accordance with its responsibilities under the Health Protection and Promotion Act. Based on current evidence, there's no indication of a health hazard with an exposure risk that would warrant public health intervention. However, environmental assessments, site remediation, and redevelopment approvals will continue through the established municipal and provincial regulatory processes, which include stringent requirements to address potential environmental and health risks, including any further mercury testing as required. OPH is ready and will continue to engage and respond as appropriate to any matters identified by city or regulatory partners. So thanks very much. We'd be willing to take any questions.
Great. Thank you very much, Dr. Arneson. So any questions from members? Member Gower. Member Gower, you are on mute.
Oh, sorry. Thank you, Chair. I know a number of members may have received an email from Councillor Curry outlining some of her concerns with the report. I'm going to touch on a few. One, I think her residents would really like somebody to be able to say whether or not they are safe or at risk. And I'm not sure the report clearly says either. And I was wondering if Medical Officer Health are you in a position to tell residents this is safe? Can anyone tell residents that what's happening is safe?
So we could say based on our health hazard investigation that there was no public health risk at the site. I think, the term safe is a very challenging one to provide to anyone in any specific context. There's many different factors that could happen at any moment that impact our safety, and so we in public health generally don't use binary terms like safe or not safe. There are many risks that occur throughout our daily lives, but the process is pretty well established around identifying health hazards that need to be acted upon based on evidence, and the conclusion was there was not a public health risk in this to this point based on our assessment.
Okay, the city's consultant, WSP, who is reviewing the data and studies submitted by the developer, has identified a number of gaps in how data was collected to form some of those studies. I just want to be clear on the process. Once the developer submits updated studies and WSP has had a chance to review those studies for completeness, is there a mechanism where OPH will automatically review those, or does a counselor or a resident need to submit those new studies for review by Ottawa Public Health?
As I mentioned in the opening remarks, there's no routine role for public health to review documents as it relates to sites. We do respond to health hazard complaints, and we do investigations under the Health Protection Promotion Act based on that process, which talks about health hazard complaints. I'll ask Dom Bremner from our environmental health lead if there's anything she wants to add about the specifics of that, about how it might come to us in terms of communication with city partners.
Yeah, no, during our investigations and with any circumstance like this, we do work really closely with our city partners as well as the MECP, who would bring anything to light. So we're in constant communication on any ongoing issues or any new issues that would come to light, that we would stay connected, and they would actually notify us right away if they had any public health concerns.
I just want to have clarity, because we are going to get additional reports back. I know you're monitoring this. I just want to make sure I understand, on behalf of Councillor Curry, how the additional reports are going to be evaluated. Is it automatic because you're watching this? Is it a high-profile file? Or is there going to be a step that the councillor or a community group has to take to make sure that you're aware of these reports and requesting or submitting a concern about health risk?
I think we can, we can continue to follow up on further information as it comes in, because this has been the subject of this motion. So, that was our intent, to continue the communication with the city departments around what information is available. But under the Health Protection and Promotion Act specifically, under our legislative mandate, no, there's no automatic review process for this type of environmental site assessment. As I mentioned, that is a process that is under legislation that is through the Ministry of Environment, Conservation and Parks, and through the Environmental Protection Act, which is what protects the environment and health of redevelopment such as this.
Okay, thank you. I just think it's important because I think until those studies are complete and done in a proper manner, there's still a significant concern about the gap of information. And I think it's important that Ottawa Public Health have the complete studies in order to make a full assessment of risk. I think the other thing I noticed in Councillor Curry's note was groundwater contamination. Is Ottawa Public Health aware that there are properties or homes in the Canada North area that are serviced by wells? There's some around the Goulburn Forest Road area, which is west of this site, and there's some a little northeast around Hertzberg Road. I just wanted to check on your awareness and if that was factored into the assessment.
I'm going to let Dom Bremner reply to that, our environmental health team.
Okay.
Yes, we were aware of the private wells. I think there's a distance that's included. We're just kind of pulling up the report to be able to answer the specifics, but we were aware and it was part of our assessment.
Okay, thank you. Chair, I'll leave it there because I see another colleague has her hand up. Thank you.
Thank you, Councillor Gower. I appreciate your clarification. So again, typically no automatic review, but in this case, Ottawa Public Health is confirming that they will review if more study is required. Member Dudas.
Thank you very much, Chair. Member Gower had referenced the email from our colleague and had referenced some of the factual items that were listed in that message, as well as some of the concerns that were raised by the community. I guess where I want to go with this is that there seems to be a strong disconnect between what we are hearing as a board, the report that is before us tonight, or the response to the motion that's before us tonight, and what's going on in the community. They are concerned. It is quite clear. Councillor Curry is not the only one who has reached out to councillors. I also have received emails from her constituents about their concerns about contaminants in their soil. And while I appreciate that OPH is doing everything within its jurisdictional ability to monitor and assess the situation, there seems to be a mental health situation here that is not being addressed. The fact that people are so deeply concerned about their well-being and they're not putting two and two together in terms of what you're saying is factual outcome of your findings and the findings of those engineering on-site, and the fact that they are in such distress that they feel that they are not safe in their own community because there's contaminants in their soil. That is something that concerns me, because a role that I do see for OPH is ensuring that the mental health and well-being of residents in our community, the community we serve, is maintained and supported. People may not always get the answer that they would like to have, but at the end of the day, the number of people who are concerned in this community and do not seem to be getting the factual information that they would like to have, or at least the assurance that they are in a safe situation, is of deep concern to me. And it seems to be to my council colleague, and it seems to be to many members in that community. So I don't really have a question for you. I think that you've answered it, and I think that you have shared, those opening remarks as well as the findings. I will be dissenting on receiving this information because I don't think the work is done. I would like to see more effort put in by OPH to being involved in not only this situation, but also future environmental concerns for our communities. And while I very much appreciate, Doctor, your stance on that we do have a limited amount of jurisdiction, maybe that jurisdiction has to be expanded. And I would very much love to talk to you about that further. So I will be dissenting on receiving this, Chair, just so you're aware, but I would like to see that further consideration be given to more outreach into this community.
Okay, thank you, Member Dudas. Member King.
Thank you, Chair. And I just wanted to ask a question, I suppose, that revolves around the questions that had been posed by the ward councillor. I know that there were two requests, one to give direction to the medical officer of health to request a stop work order, which I would be loath to do. I defer to the professional capacity of Ottawa Public Health. And we know that the report concluded that no indication of exposure risk at this site or in surrounding residential areas have been demonstrated at this time, though there are reports that are being evaluated. So, I don't think that that would be an appropriate recommendation of this board based on the scientific data and other technical analysis that you're undertaking. But I was curious about receiving some analysis as to the second request around writing a letter outlining the gap in legislation that does not address situations like this where contamination could occur that would endanger human and wildlife health. I know in your preamble, in your statement, you had said that the regulations that are provided by the provincial government are enough. I'm just wondering if you could provide a little bit more insight to address the ward councillor's concerns in terms of the letter that she would have wanted the Board of Health to write to the Ministry of Environment, Conservation and Parks that would highlight that the legislation is not clear, that intervention can happen that would satisfy the precautionary principle and allow government to immediately exercise its duty of care. So I'm just curious if you can provide more insight, whether you do see there being a gap in the legislation based on the concerns of the ward councillor and the community.
I haven't seen this communication to board members. I wasn't aware of it. I'm just finding out about it now. As said in the report, we follow established processes. We do always have to stick to facts and what is evidence-based. We manage many health hazard complaints. Almost every day we're managing health hazard complaints. And often there is, unfortunately, an emotional element to them where people are not satisfied with the actions that are being taken. But the reality is that we have to take actions in terms of the evidence that we have to support those actions as a mitigation. And it's important that people recognize that, and the board members recognize that, the Health Protection and Promotion Act has very clearly outlined the ability of medical officers of health, associate medical officers of health, and public health inspectors to act under that act without the, we don't need to bring it to the board each time we act if there's a health risk or an immediate health risk, which we do regularly. And that's a big, important part of our job that we take very seriously. And the other side of that is we cannot act based on hypotheses about what may occur down the road in many different scenarios. I think the precautionary principle and the duty of care are not terms that are clearly defined or spelled out in the Health Protection Act as principles that we're supposed to apply. We're supposed to be doing health risk assessments based on and health hazard assessments based on our established processes, which we've done here. And then as it relates to a gap environmental health and environmental protection legislation in the province. We have not observed a gap, and we're not saying that there's a gap here. So in terms of a gap in that legislation, that would be something that you would need to seek expertise as it relates to environmental health legislation. I just think it's important that people recognize that just because it's environmental health legislation doesn't mean that it doesn't serve an important role in protecting public health. Many of the protections of public health in Ottawa and Ontario actually are through other organizations and other ministries that are that we as society have placed regulatory frameworks in place to ensure the protections of environmental and public health, and those are the things that we are depending on for protection in this situation and others.
I appreciate that analysis and that response. Thank you, Chair.
Thank you, Member King. Member Ejiofor.
Yeah, thank you very much, everyone, and good evening. I also am very glad for the findings that show that there isn't what we thought was going to be like a health issue based on testing. So as much as I would like to accept that on its face value, backed up by the results, which can be presented to the community if they ever seek it, because like Dr. Anderson said, nobody is going to put their name to reassuring anyone about, saying that on safety, like 100% guarantee for safety, because safety comprises a lot of components and is very dynamic. But at the same time, it would also be good to investigate the origins of this, the fears of the community. How did this allegation begin about the soil not being safe for residents? Like, would it be okay to further conduct a survey or interview the residents to see if there are any common symptoms that they experience, that so that everybody is confident of the report that has been submitted. So just to be able to balance things out, as much as we've been reassured that that there is nothing to be afraid of based on testing. Have the residents been brought into this investigation? Have they been interviewed and to find out the origins of their complaints, and are there symptoms that are common or to have raised their fears?
Sorry, I turned my mic off instead of turning on. Thanks for the question. So no, we have not interviewed residents. One of the challenges with environmental health hazard assessments is that people are exposed to many different exposures throughout their lives. If you think through a day in your daily life, the number of things that you may eat or drink, these can all have, or the air we breathe can all have an impact on our health, whether it's at our workplace or school or around our home, and we all have different levels of exposure to those things. When we're assessing health hazards, we cannot just isolate one risk alone. We have to understand the full exposures. There has to be an exposure pathway between that risk. there's many, many contaminants that exist in our environment all the time, but there has to be a reason why we're exposed to those to lead to health problems. The challenge, if you look for health problems and then try to connect them to an exposure, it can become very difficult, even with a single clear exposure to a contaminant. It can be difficult to attribute an illness that may happen many years later after the exposure, and so it would require a lot of resources, and it generally does not provide conclusive answers. So the process for investigating health hazards considers this and considers the approach to having to establish not only that there's a risk, but also a plausible exposure that would lead to a specific illness for us to investigate. Otherwise, we may enter into a situation where we're looking to connect something to a specific source when in reality it may be related to something else that we haven't looked at. And this is actually a particularly challenging issue with a lot of chronic diseases and exposures, and is not a good approach to following up on health hazards.
Thank you very much. And to clarify, in this case, was it symptoms that were reported, or was it more the history of the site that was the concern?
Yeah, so that's thanks for that question. Yeah, I mean, with the report was the health hazard reports that we received were about concerns about the contaminant itself and its potential to cause illness. We did not receive any reports of individuals who had mercury related illnesses.
Okay, thank you very much. I'm not seeing any other hands up. I just wanted to say, health hazard complaint investigations don't often get brought before the Board of Health, but I wanted to acknowledge the work done by OPH's environmental health team. The work is often unseen in responding to health hazards, but it is ongoing between Board of Health meetings. And with regards to this issue, there are still many regulatory phases that the process may proceed through. And we want residents to know that if at any time in this process there is a public health risk or emergency, OPH will act accordingly. So I know this has been a challenging issue for the community of Canada North, and I wanted to recognize Councillor Curry for her continued advocacy and commitment to the needs and concerns of your community. Everyone around this table has felt it. So is this item received with a dissent from Member Dudas? Thank you very much. We have no information previously distributed. There are no in-camera items. Motion to adopt reports. Member Chung.
Be it resolved that the Chair of the Board of Health verbal Ottawa Public Health Financial Stability Report for publishing a wastewater-based early warning system for toxic drug supply monitoring in Ottawa and response to notice of motion Canada Lakes Golf Course redevelopment be received and adopted.
Is this carried? Thank you. There are no motions of which notice has been previously given. Are there any motions requiring suspension of the rules? Seeing none, any notices of motion? Seeing none, confirmation by law, Member Chung.
Be Be it resolved that confirmation bylaw number 2026-3, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of June 15th, 2026, be read and passed.
This is carried. Thank you. Are there any inquiries? Seeing none, I just wanted to acknowledge that the kuluk is still burning and has been lovingly tended to by Elder Ripa throughout the entire meeting. So thank you for being with us and for keeping the flame lit throughout the whole meeting, which was longer than usual. And I wanted to give you an opportunity to extinguish it if you like before we adjourn the meeting.
Thank you. Just very briefly, I thought about a couple of things before I put the fire out. I thought of something that was shared with me by that I respected. Is it? Okay. She was a child when the hospital in my small town was built, and she actually had a medical issue that could have killed her, but the doctor that was stationed there ordered the medication just in time, and there was not even an airstrip in the little settlement. It landed on the water. And she was treated, and she lived to be well over 80 years old. She was very instrumental for many people. So what she shared with me, I thought of, because it's really all about relationships. There are relationships that have been built here and are being built here that will have a lasting impact. And yeah, it's by working together and respecting and working towards a common goal. I'm a very grateful Inuk here, living in this area for the past 30 years because of what we've been supported many times over the years. This is very kind of a small thing for many of you, but it's a big thing for me because every time our garbage gets collected, I'm so grateful for the services that we get. Yeah, I just wanted to say that there's many more that I can share, but I just want to say I'm grateful and thank you for having me tonight. I really enjoyed it, and just want to say also to don't forget to take care of yourselves over the summer, because I know there's lots of hard work ahead of you. And when I was a child, my mother always left a little light at the corner of our kuluk. That was our night light, because we had no electricity whatsoever at the time. And in the winter months, it would be very dark. And so this is a reminder to all of us to keep ourselves healthy and to look after ourselves and do what you need to do over the summer, because we're people and we do get tired and there's a lot of things going on. But I want to say that by working together, we can accomplish a lot, just like how my people were saved from, a lot of people died, but because of that medical intervention, my mother was treated and gave birth to 9 children. And so you are having an impact on the things that you do to support the people, the common people and the people in the city. Kuya namig ukalatitagun atagama. Thank you.
Thank you again, Elder Ripa, for joining us this evening. We're very grateful for your presence and for sharing your traditions with us, and perfect, inspiring words to send us into the summer months. So thank you again for being here. With that, we are adjourned. Our next meeting is Monday, September 21st. So have a fantastic summer, everyone. And as Elder Ripa was saying, take care of yourselves, stay well, enjoy, and we'll see you in the fall. Thank you.